of the issues also that really interests Amy and myself is, it's kind of common knowledge that a therapist should never sleep with their client. That's like the common knowledge. That's
Yeah.
like very clear. But there's a lot of other abuses and things that can happen to clients that are equally damaging and more complicated for people to understand, like the blurring of boundaries, like a therapist telling their patients that they love them and that they're special and that they
Yeah.
holding their hand during sessions and calling them after hours and maybe there's only innuendo sexually, but I think that kind of abuse, or it's just strictly emotional, like they're reparenting or
Mm-hmm.
anyway, it's still equally, it never turns out well and
You're right.
equally as harmful and traumatic. And so my question is always, what if a therapist goes down that road and it's not technically sexual or they haven't actually slept with the client, but they've done all these other things, is that taught in ethics? Would a therapist actually know that by telling a client that they love them on a regular basis and telling them that they're favored, would that be clear to a therapist as, oh, this is a violation, or is it more
Yeah, that's a good question. I don't know as if it goes that deep in terms of
uh,
teaching at the college level. You know what I'm saying? I mean, I've brought that up with the supervisees that I've had. I'd have to take a look at their curriculum to really know for sure.
Then
Common sense, doesn't it? That you would say, these I know, I saw your eye roll there.
that's what we think.
yeah, I mean,
But I mean, are they mostly just teaching modalities and
Yeah,
not how to do therapy safely and properly and ethically?
and I think that they're really getting into this kind of I don't know, please don't be offended when I say this, but it's kind of more along the woke ideology. They're really getting into the political foray. And I think that's all well and good, but at the same time, it's almost like an element of indoctrination. And I think they're not teaching that's it. They're not teaching critical thinking skills. Read this, decide how does this fit into your value system? How does this fit into your client's value system? What about their cultural, aspects, those kinds of things. I just think that it's really lacking in like I said, common sense, or how to do a deep dive into what is ethical, what is not ethical. How would you, and I just remember not just the role playing, but also giving case examples. We did that heavily when I was in grad school. Here's a case example. How would you proceed with this particular client? And they would make up a client, obviously, but there were some certain flags that you would see and say, well, I certainly wouldn't do X, Y, and Z with this person, or this person seems to be, very vulnerable. So we would not avoid, but we would be gentle, around these certain topics. Does that make sense?
Yeah,
yeah,
but it's this, my mind is just being blown because I'm thinking, what are they doing for 2 years? Because it doesn't seem like the skills that they desperately need, it doesn't seem like they're getting them. And
It's a
it's
lot
just
of
like,
modality.
it
It's a lot
just seems
of,
like good luck. And
yeah, yep, I agree. The clinical, yeah, I mean, in my state, there's different kinds, quote unquote, of social workers. One is administrative, where you work at agencies and you do the funding and the grants and, all that stuff. Um, there's social service programs. I mean, there's just many, but then there's the clinical component. And that's the part I think that's the lacking, where they get some, but I don't think they get enough. Let's put it that way.